Hi everyone, it's Jasmine, and in today's video we are going to be talking about thyroid health and all that your thyroid does for your body and how to make sure that yours is functioning properly. So I hope you enjoy this video and let's begin. To begin, let's talk about what the thyroid is. So the thyroid is a butterfly-shaped gland that's located in the neck, and it produces hormones, specifically T3 and T4 hormones, that are crucial for regulating metabolism and various bodily functions. The thyroid function and importance is that it plays a vital role in maintaining overall health. It influences energy levels, temperature regulation, and other essential processes in the body. When it comes to thyroid disorders, two very common thyroid problems are either 1, hypothyroidism, or 2, hyperthyroidism. Now, if we look at hypothyroidism, it's a condition where the thyroid gland produces insufficient thyroid hormones, which leads to a slowed metabolism. Common causes of this include autoimmune disorders such as Hashimoto's disease, iodine deficiency, or surgical removal of the thyroid. Symptoms of hypothyroidism include fatigue, weight gain, cold sensitivity, so finding it cold when a lot of people don't find it cold, and having a tough time managing your internal temperature, and sluggishness. Hyperthyroidism, on the other hand, is a condition that's characterized by an overactive thyroid gland, which results in excessive production of the thyroid hormones. So common causes of this are Graves' disease, thyroid nodules, so actual nodules growing on your thyroid, or inflammation of the thyroid. Symptoms of hyperthyroidism include weight loss, a rapid heartbeat, anxiety, and increased sensitivity to heat. Now, you may be wondering what factors put you at a higher risk of developing thyroid problems, and there's actually many. Gender is one of these factors, as women are more prone to thyroid disorders than men. Age is another factor, as your increased age results in increased risk for thyroid problems. If you have a family history, especially a history of autoimmune conditions like Hashimoto's or Graves' disease, you're actually at a higher risk for developing thyroid problems as well. Or if you have a personal history of other autoimmune diseases, that as well can put you at a higher risk. Radiation exposure is another factor that can increase one's risk to developing thyroid problems, and radiation exposure can come from medical treatments or due to environmental factors. Pregnancy is another factor that puts people at risk for thyroid problems, as women are more susceptible to thyroid issues during or after they're pregnant. Smoking is another factor that puts you at risk, as tobacco smoke contains substances that can increase the risk of thyroid problems, particularly Graves' disease. And stress is another risk factor. When it comes to diagnosing and testing for thyroid problems, there's multiple ways in which it can be done. Clinical evaluation by a medical professional, so getting a regular checkup, is very important, as they will be able to see whether you are having changes in weight, cold or heat sensitivity, and so on, and see if you're presenting with any other symptoms of thyroid issues. You can also have blood tests done, and they will measure the level of thyroid hormones to see if they're within normal range. You can have antibody tests done as well, and what these will do is identify autoimmune thyroid disorders like Hashimoto's or Graves' disease. Ultrasound imaging can also assess the size, shape, and texture of the thyroid gland, which can help identify if there's any nodules or abnormalities on your thyroids. Radioactive iodine uptake test is also a test that measures how much iodine the thyroid takes up to help diagnose the hyperthyroidism. And then you can also get a thyroid scan, which would provide images of the thyroid to assist in identifying, again, whether there are nodules or functional abnormalities on the thyroid itself. There are a few treatment options available if you do have thyroid problems. One of these treatment options is to get on medication. So if you're lacking thyroid hormone replacement is available, or if you have the opposite and have an excessive production of thyroid hormones, you can have anti-thyroid drugs, which are commonly prescribed to restore your hormone levels to normal ranges. Then a treatment option again is lifestyle changes, similar to a lot of other conditions. So dietary modifications and stress management can complement medication for improving your overall well-being. Then surgery is a final option. So in some cases, if you have excessive hormone production or nodules on the thyroid, you may have to have the surgical removal of part or all of the thyroid gland. If we look at lifestyle tips a little bit more closely as either a treatment or prevention option for thyroid issues, we can look at having a balanced diet. So again, I previously mentioned that on the last slide, but a balanced diet for thyroid health would ensure that your diet is rich in iodine, selenium, and zinc. And you'd want to include whole grains, lean proteins, fruits and vegetables, and limit processed foods and refined sugars. Similar to pretty much any other health condition, you want to make sure you're engaging in regular exercise. Engage in regular physical activities to support your overall well-being, as well as to manage your weight, which is a factor that can impact your thyroid health. Stress management is another big lifestyle tip, whether it be through meditation, yoga, or deep breathing. Getting adequate sleep is extremely important, so getting on a sufficient and quality sleep cycle that allows you to sleep deeply and well every single night. Another big tip is to limit environmental toxins, so reduce your exposure to the toxins and pollutants. And a way you can do this is by choosing natural cleaning products and minimizing your exposure to harmful chemicals that can be found in a lot of sprays, like Windex, for example, which is a very common household product. Hydration is key for, again, pretty much any health issue. So stay adequately hydrated, as it's essential for overall health and it supports bodily functions, including your metabolism. If you do smoke, please look at quitting and consider the quitting options and support programs that may be available for you, as smoking is associated with an increased risk for thyroid disorders. And if you do drink alcohol, limit your consumption, as excessive alcohol intake can impact your thyroid function big time. In all, having a healthy thyroid is of great importance, and I hope you learned from this video different ways that you can maintain your thyroid health or signs and symptoms to look out for if you are having issues with your thyroid. If you are, again, reach out to a medical professional, as they can do a clinical evaluation and get you set up on treatment options that are perfect for you and your lifestyle. Thank you so much for watching, and I'll see you soon with my next video.